Hi, I'll be introducing My Your Health mobile app today. It's a Singapore-based one-stop mental health app. So basically, I'll be going through certain points here, the background and why a mobile app, the features of this app, and some learning points that I have. So basically, in Singapore and in generally in Asia, there's high stigmatization of mental illness. People with mental illness are perceived as mad or dangerous, and this high stigmatization actually acts as a barrier to seeking help. So stigmatization actually widens the social distance and causes a breakdown in social interactions between people with mental health illnesses and normal people like you and me. And actually it's important because people with mental health illnesses would need social interactions to actually improve their condition. So why Singapore is because Singapore is a small landmass. So we can see that physical distance to seeking help is really not an issue. So getting help is not an issue here because traveling time is actually quite low. So more than 2/3 Singaporeans here has a lifetime mental disorder, but they did not seek help. And why is this so? This is conceived on a two-fold level reasoning. Individuals are actually in denial, or they perceive that they have the ability to cope independently, or they may refuse to be identified as mentally ill and only seek medical help if the problem was conceptualized as a physical issue. Basically, they will tend to seek informal help even if it is confirmed as psychological issues, like referring to friends or going to a general practitioner instead of seeking professional help. On a societal level, stigmatization and lack of mental health literacy actually creates a misconception about individuals living with mental illness. Currently, only 3.6% of people with mental health illnesses actually use online support groups, and out of a Singapore population, only 22.5% actually participated in a mental health awareness campaign before. So why a mobile app? It's because mobile adoption rates are more than 50% in Singapore and more than 78% of its population are internet users. People are able to access these services, mental health services, in their own environment without having to contend with the stigma. And benefits of mobile app is privacy, anonymity, and availability at low cost. So currently in Singapore, we can see that there are some newly created self-help mobile apps, which is aimed at improving individuals' mental health through practicing mindfulness and physical counseling sessions. But these are insufficient because combating mental health illnesses like depression is not enough because there's a self-reinforcing effect where individuals with mental illnesses have lower social skills. They tend to engage people in a way that support is lost. So they tend to isolate themselves. They will not want to seek help, and they will actually talk to people in a way where using language, they will tend to push others away. So introducing My Your Health mobile app. So basically, we want to combat stigma and poor social interactions on an individual, group, and social level. So the flow of the app is this. The self-assessment will lead to a telepsychiatry session. There will be a group therapy and also an art exhibition. So for self-assessment, it's adapted from the online mental health America screening test. We have depression tests, anxiety tests, PTSD tests, etc. All these tests actually last about 10 to 15 minutes. It's meant to encourage people who has a constant low quality mental health, but they are not sure if these symptoms are significant enough to warrant treatment. There'll be an e-report generated that allows them to select telepsychiatry as a possible service. So telepsychiatry is when a psychiatrist contact the patients through the app messaging function to schedule an e-appointment to the video function, and there'll be a one-to-one session where the individual can actually share with the therapist about any concerns they have. Next, we have the group interaction. So there'll be a group therapy schedule where individuals can join a group therapy based on their illness, and also they can engage in mutual sharing, which can help to improve interpersonal communication skills because they can practice within a group. The session will be conducted through live video session online, and there'll be a notification of the starting time for individuals, reminding them of the session. And there's also a live camera and chat bot here, like a live Zoom session. So the last function is a art exhibition. So this is a virtual art exhibition where thematic artworks are exhibited by mentally ill patients. There'll be a community board where normal general public can actually share words of kindness towards towards patients, and also reflect on the experience and how it makes them feel after looking at the artwork. So the artist will describe his or her mental experience through expressive art, and there's also a link for you to share with other people after reading. So my takeaway is that seeking psychological help from professional is very important, and also we need to harness the strength of being in a group. We can use them as a practice tool, and also we need to be a progressive society. However, this is dependent on the public's will to help us.